This is Radio Health Journal. I'm Nancy Benson. This week, black lung disease. A relic of the past, right? Unfortunately, no.
I've met so many guys with black lung disease, more than I can probably count.
The resurgence of coal mining's black lung disease when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
We had a number of them that took from 6 to 10 days.
Why is it so historically difficult for Native Americans to vote? Then,
I got up, got my kids ready to get on a computer, and had work to do myself, and there's just not enough time in the day.
Our prayers with the people who are parents this year. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Come and listen, you fellers, so young and so fine, and seek not your fortunes in the dark, dreary mines.
Unless you're of a certain age or live near coal country in the eastern part of the U.S., black lung disease isn't something you're probably familiar with. And even then, most people figure that black lung is an illness from ancient history, a relic of the past, right? Unfortunately, no. Black lung is entirely preventable, yet it's been on the rise in the U.S. since the late 1990s, affecting thousands of coal miners and their families.
I've met so many guys with black lung disease, more than I can probably count. It's a disturbingly descriptive and accurately descriptive title for the disease. It's coal workers pneumoconiosis is the actual technical name, but it's basically where you inhale large amounts of fine dust, primarily coal dust, that causes severe and irreversible scarring in the lungs.
That's Chris Hamby, Pulitzer Prize-winning reporter for the New York Times, and author of Soul Full of Coal Dust, A Fight for Breath and Justice in Appalachia.
I think the thing that really sticks with you is if you've talked with someone who has the advanced form of the disease, their struggles to draw in every breath is just, it's kind of a gasp, a constant fight for air just to continue breathing, and it's incredibly striking to hear it.
That's not supposed to be happening anymore. In 1969, Congress enacted the Coal Mine Health and Safety Act, which promised coal miners two things. One, that coal companies would control the amount of coal dust in the mines, and two, fair compensation and medical coverage for miners with black lung disease.
Those two promises, however, 50 years later, remain unfilled, unfortunately. It is an entirely preventable disease, and it's really, in a lot of ways, disgraceful that we are now at a point where government researchers have documented that levels of severe disease in recent years now are at the highest levels ever recorded.
But why? If the law states that coal companies must maintain basic airflow in the mines to ensure miners' safety, why are they still getting black lung and in such great numbers?
I think over the years, companies have been very good at figuring out both exploiting loopholes in the regulatory system, which largely relies on them to police themselves, and then also in many cases, and I don't know how many miners I've talked to or how well documented this is, I mean, it is pretty well established that there has just been rampant fraud throughout the industry on the samples that they are required to collect that are supposed to prove that they're complying with the limits on the amounts of dust in the mine.
Plus, Hamby says for years, coal companies disputed evidence that miners even had black lung.
The coal companies have a very well-credentialed bench of experts, medical experts, different radiologists, pulmonologists, pathologists who reliably provide reports that indicate that miners do not have black lung. To some degree, you would expect some of that in any sort of litigation context in which you have dueling expert witnesses. But in this case, the resource disparity really accentuates that. And then in addition, I was really surprised to learn in my research on this that for about 40 years, actually, the go-to radiologists for coal companies have really been this small unit at Johns Hopkins that has had a really outsized impact on probably thousands of cases over the years.
Hamby says somehow, for 4 decades, all these x-rays were read by just one doctor who attributed abnormalities to tuberculosis, bacterial infections, and the like, but never to black lung.
You know, the credibility that comes with the name Johns Hopkins really had an enormous impact on a lot of cases over the years, and miners lost a lot of cases in significant part because of those x-ray readings.
And it also created a disincentive for lawyers to take black lung cases. But one miner, a man named Gary Fox, refused to take no for an answer. He was extremely ill when he approached John Klein, an attorney who grew up in Appalachia. Klein was determined to help coal miners despite the odds.
The injustices of the system overall are certainly something that many, many miners have faced, but Gary's was sort of emblematic of this. It was kind of a worst-case scenario of what can happen when, as John Klein was starting to uncover, you have withheld evidence in claims, and that leads to wrongful denials of benefits. So John began to document the number of cases in which this was true over the years and the impact that it was having, but it was perhaps nowhere more stark than in Gary's case.
Hamby says Klein's digging showed that in previous black lung cases, all the medical evidence was not provided to the court. Other evidence was completely misrepresented. Gary Fox died of black lung disease in 2009, but his case led to new federal regulations 5 years later.
There was a slight reduction in the overall dust limit, but more consequentially, there were changes that closed a number of the loopholes that companies had exploited over the years to submit samples that were not representative of what miners were actually breathing. And there is today, companies are required to use continuous computer-based sampling devices rather than an old device that was easier to game, to sort of fake and cheat the sample.
But will that be enough to correct the problem?
Unfortunately, we won't really know probably for years, because it takes sometimes years for this accumulation of dust to build up and cause disease in miners' lungs. So we'll really have to be watching for the next generation of miners to see if what we've done has worked and if they really do get to avoid the unfortunate fate that so many of their fathers and grandfathers endured.
For many people, coal mining is the last job on Earth they'd want. The danger, the dark, and the dust take a special breed.
That was the amazing thing. Working on this book is, it's been, for the last 6 years or so, I've really gotten to spend a lot of time with coal miners and just talking about the work that they do. And I can tell you they just really light up when they talk about it. And I can see why, because it's fascinating. I mean, I came to really love talking about it. And I think that people tend to stereotype or look down on miners sometimes, and they really don't understand how difficult the job is. A lot of the miners that I talk to, they may have not had a lot of formal education, but they were very smart people. And you have to know a lot just to stay alive in these mines. The conditions are incredibly harsh. I mean, not only does it take physical toughness, but it takes a lot of mental acuity and toughness as well.
But with alternative fuel sources such as solar and wind energy on the rise, the future of coal mining is in question. Hamby says we owe it to miners to have serious conversations about the future of coal country. Hamby's book is Soul Full of Coal Dust, available now. You can learn more about all our guests by visiting our website at radiohealthjournal.org. Our writer-producer this week is Polly Hansen. Studio production by Jason Dickey. I'm Nancy Benson.
Where the danger is double and pleasures are few, where the rain never falls and the sun never shines. Well, it's dark as a dungeon way down in the mine.
Radio Health Journal returns in just a moment.
Multiple sclerosis affects an estimated 1 million adults in the U.S. alone. In multiple sclerosis, the immune system mistakenly attacks the central nervous system, affecting a person's muscle control, balance, vision, sensation, and cognitive function. Though the exact causes are unknown, Epstein-Barr virus, a very common virus which causes mononucleosis, is the only risk factor identified to date that appears to be necessary for the development of MS. An investigational therapy called ATA188 specifically recognizes Epstein-Barr virus-infected B cells. It is currently being studied in a clinical trial, which is now seeking participants. If you or someone you know is living with progressive MS and is interested in participating in the ATA188 clinical trial, please email patientadvocacy@atarabio.com to learn more and find a trial site in your area. That's patientadvocacy@atarabio.com.
A message from Greenstone, a Pfizer company. Most of us know about generic medications, drugs that work in the same way and provide the same clinical benefit as brand name medications, often at a lower price. Most generics are made by a different manufacturer than the original brand, but there is also a lesser-known category of generic medications called Authorized Generics that are made by the same manufacturer of the brand name drug. Authorized generics, like all generics, meet FDA quality and manufacturing standards. Authorized generics are the same as the brand name drug and only differ in that they do not have the brand name on their labels and may have a different marking on the medication. In limited cases, they may have a different color. Authorized generics are not new. Greenstone has been supplying authorized generics for over 25 years. Talk to your pharmacist or visit greenstonegenerics.com to learn more and see if they manufacture an authorized generic version of the medication you take.
As many as 89% of hospitalized COVID-19 patients are at risk of a complication called cytokine storm, a leading cause of COVID death. But there's good news. Hospitals across the U.S. are enrolling patients in a trial evaluating lemzilumab, a treatment candidate designed specifically to stop this storm, even with only 1 day of treatment. Dr. Cameron Durant, CEO of Humanigen, the company developing lemzilumab.
Having a therapeutic that can significantly reduce the time to recovery from COVID-19 and send patients home earlier could dramatically impact the arc of this pandemic.
Participating in the study means access to a potential treatment option in addition to standard of care therapies. Trial participant Mark Baranski shares his experience.
I don't know if I received lemzilumab or not, but I viewed the trial as doing everything I could for my recovery while contributing to the fight against COVID-19. I certainly encourage others to do the same.
To learn more and find this trial near you, visit StopStorm.com. That's StopStorm.com.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Time is going to just slap you around because you're not able to anticipate what's coming at you and get ready for it. And it leads to a life of crisis after crisis after crisis.
Time blindness. People who are always late and simply can't perceive the passage of time.
Then what does the hand you use have to do with what makes you, you?
I do think it's a little bit of my identity. I have to say, when I meet somebody and they say that they're left-handed, there's some type of bond or kinship.
All that and more on Radio Health Journal.